Assalamu alaikum everybody, welcome back to my channel. If you guys have been watching my videos since 2021, and welcome to my channel if you are new here. My name is Jeriana Corchado and I've been making YouTube videos about nursing since the beginning of my journey, since 2021. My first video was back in August of 2021 and it was about orientation and what to expect, like what I wore, like little details like that, because when I was looking up nursing school videos, a lot of them were just aesthetics, what they wore, and just like what drinks they got. So I was like, first of all, I need to make a YouTube channel that's real, authentic nursing school videos to help others with their journeys. And I also wanted, of course, to go through my day for orientation. So for those of you who just got accepted into nursing school, congratulations. It's both exciting and overwhelming at first. You don't know what to expect. You're looking at all these videos and you think it's all this aesthetic stuff and you're excited, you're nervous, you don't know how to study, you want to buy all of these like cool things like an iPad. And yes, an iPad can be beneficial in terms of like looking up how to study and stuff. Don't overwhelm yourself because you're not going to know what to study and what to prioritize until you actually get to know your professor and what textbooks they prioritize and how they make their exams. For example, like their textbooks, if they have all these textbooks for one class, okay, we'll go to your professor and be like, well, where do the questions come from? Do they come from this textbook or do they come from this textbook? So in that orientation video, I just said that I dressed like business casual. I think I wore like black pants, like a button-down white shirt, and then probably I think I wore a blazer, which was a little bit over the top, but you don't have to wear a blazer. I brought a folder with my acceptance information packet. So once I was accepted, it was just an email that said, congratulations, you've been accepted into the program. And then it had like a huge packet of paperwork to complete, and then some like physical paperwork to bring to like a doctor or a nurse practitioner, vaccine information. So that whole packet, I just printed it out, I put it into a folder, I brought a notebook, and then when I actually got to orientation, I wrote down who spoke and who they were and what to go to them for. I rewatched the video and I specifically said I was having trouble like logging into Blackboard, which is what we used for that program at school. And during orientation, like a librarian was like, I'm the person you go to in order to help with your login, Blackboard, any problems like that. So that was pretty helpful and I really stressed that. And then I also said, like, make sure you log into your accounts, and like if you're using Canvas or Blackboard, make sure you can log in don't have any problems before the first day of school. So that was the orientation video that I had back in August 7th, 2021. So cute. I was so happy, so excited. And then August 15th, 2021, I had a video of paying for nursing school. A lot of people ask me like, oh, how much do you have in student loans? So I'm just gonna like blast myself out there. I have about $7,000 worth of student loans because I went through the Department of Education for student loans, and I specifically made sure that I did unsubsidized loans. Unsubsidized loans do not accumulate interest while you're in school. I do have to get clarification. I'm not sure because I'm going back to school. I'm not sure if I know I have to like complete paperwork in order to stop like payments and stop interest, but that's for unsubsidized. Subsidized loans through the Department of Education, they do accumulate interest when you're in school. So I was like, no, I'm just gonna get unsubsidized loans. I also saved up, I think about $15,000. I can't really remember the specific, but I did save between $10,000 to $15,000 in order to pay for the student responsibility. So after all the grants, after FAFSA, after the Department of Education loans, I was still responsible for, I think, like a lot of money. So each semester I was given like a funding plan. Each semester I was given a funding plan that covered 2 semesters. So then they would tell me how much I would have to pay every month. So that was definitely a lot of money. And then if you do have to repeat a class, you have to get a new funding plan to include that class that you have to remake. So that's how paying for nursing school. Guys, if you have any questions at any point, please DM me on Instagram. I will put my information, like always, in the description box. My Instagram account is now private, and I do not post as much, but I don't really have much going on, so I am always responding to questions about nursing school. So that was paying for nursing school, picking a nursing school. So I definitely stressed about accreditation. I was surprised that a lot of my classmates didn't know about the different accreditations. So if your school, specifically if you go to do your associates instead of going straight for your bachelor's, if you go to a school that's not fully accredited for your associates, you'll find it hard to go look for a different school in order to get your bachelor's, because if your associate degree in the science of nursing is not from ACEN accreditation, then your credits might not transfer to a fully accredited college. My school was fully accredited. I made sure of that, and it does depend on the campus as well. So the campus closest to me was not fully accredited, so I had to go to a farther location in order to get the full accreditation. Once I obtained my degree, I was able to transfer to a different school that was also fully accredited. All the credits transferred over. I didn't have any problems looking into my bachelor's degree in the science of nursing. Also, when you're picking a school, I think everybody can agree as a nurse that all nursing schools are kind of like bad. Like, they all suck in their own way. Whether some students you know, don't have to repeat classes, but then they have to repeat the NCLEX, you know, your state board exams, or if you do have to repeat classes throughout the semester because, you know, you don't have great professors, or they're constantly getting new professors and you don't have a good continuity of your education, you'll have a hard time like getting through the program, but you'll probably pass the NCLEX the first time around. So I did stress on one of these videos, probably picking nursing school, was every nursing school has like their statistics, like their pass rate, their NCLEX pass rate, and their graduation rate, as well as job placement after, you know, they graduate. So definitely look at those percentages. But also, when you're making these phone calls and going to these different schools, colleges in person, like, what's the vibe that you're getting from them? Are they desperate for numbers? Are they pushy? Are they like rushing you to start? Or are they like explaining everything, making sure that you're comfortable, making sure that you understand you know, their policies, procedures, and how their program works? That's super important. Otherwise, picking a nursing school, like, just make sure that it's local enough. Commuting, it's definitely stressful, especially if you have to work. And then remember, when they're picking clinical sites, it's not a 50-mile radius from where you live. It's clinical sites that are in a 50-mile radius within the school. So not to throw like my location out there, but because I had to go to a farther school, that 50-mile radius was from that campus, so I was going even farther for clinical sites. And then clinicals are off-campus experiences in a clinical setting, you know, with other nurses in hospitals, rehab facilities, and stuff like that. Sometimes even clinics. So now for the fun stuff, I did a supply haul video for nursing school on August 29th, 2021. And let me tell you, I was so excited. I bought a lot of stuff off Amazon, and I didn't buy too many things that weren't like unimportant. But the one thing that I started off with, which was so cute, was unboxing my stethoscope, my very first stethoscope that I still use today. It's a Littmann 3. They are $110 now. They used to be like $60. I bought the cheapest color, which was black, and it was $60. Now it's like $110. I bought one of my closest friends her first stethoscope because it's very important to get a good quality one, because you don't want it breaking or snapping, like, or like one of the earpieces falling off. So if you have $100, like, invest in the $100. If you don't have $100, then just invest in something that you think, you know, has good decent reviews. And it doesn't have to be the Littmann 3. There's a different there's like, I think a Littmann 2 is like only $50. But anything that's just durable and that's gonna last you, I mean, mine's lasted me throughout the entire nursing school and like the beginning of my nursing career. The black travel case that everybody gets that puts like the stethoscope, the shears, and the pen lights, you don't need that. Don't get that. You can put it inside of your clinical bag, but at the end of the day, you're going to be having your stethoscope either around your neck, which is not the safest. Just put it in your pocket. Your pen light is going to be in your pocket. Your pens are going to be in your pocket. And then skipping a couple other things, the foldable clipboard. So there's a foldable clipboard that folds in half. That's nice if you're not going to put your foldable clipboard in your pocket, which as a nursing student, everything is going to go in your pockets because you most likely don't have a workstation. There's probably not a lot of space for you to get your stuff done. There's like a tri-fold foldable clipboard. I would recommend that one. I didn't get it, but I've been using the foldable clipboard even for nursing, but because I don't have to force it in my pocket, like the one that folds just in half is pretty good for me. And then it did not fit, like my foldable clipboard did not fit in my pocket, so I had to like hold like my nursing diagnosis book, pocketbook. It was a lot of stuff to hold and then like stuff in my pocket. It was just a hot mess. So if you can get the tri-fold foldable clipboard, perfect. And then the shears, yes, I don't have a pair of shears myself. I don't know where my pink ones went from nursing school, but like a small pair of shears because opening like sometimes meds, opening like sometimes normal saline bags, like you need shears. A lot of nurses ask you for shears, or like scissors, another name for them. So yes, pen lights, yes, a clinical bag. I got one off Amazon. It was like $50. It was nice. I ended up giving it to my sister, but a very durable, decent size clinical bag so you can carry your textbooks and everything that you are bringing. Usually when you go to clinical, sometimes you bring a nursing diagnosis book so you can work on your care plans, and a drug book so you can quickly reference drugs. And then badge reels, yes, like treat yourself to badge reels when you can. The mini lanyard pens and Sharpies, those are super convenient because a lot of nurses don't carry Sharpies and are constantly asking each other for Sharpies, so those are pretty convenient. You do not need notepads. If anything, you're gonna get comfortable with using large pieces of paper like printer paper. Those are convenient, but just constantly getting notebooks and stuff. If you get one notebook just for clinical, perfect, but little notepads, I got those and I didn't even use them. And then of course a lot of pens. So that was a recap of the first few of the videos that I had back in 2021. After that, I was just making like update videos. I was going through like my exam grades and everything. Nursing school is very stressful because the first semester fundamentals, you're trying to think like a nurse, you're trying to get comfortable with critical thinking, and it's very hard to switch from how in grade school it's just like A, B, C, D. Well, now you have select all that apply, and you have to pick the most orange, which doesn't make sense. It didn't make sense to me. But I would say probably the more than half of the first semester of fundamentals, I finally like got it, it clicked, and critical thinking came a little bit easier to me. You're going to go through physical assessment for fundamentals. You're going to learn how to assess the body, just like the basics, and then that was pretty much it. So I have to do a quick update, of course. Again, if you're new to my channel, I did graduate May 17th, 2023. And then I took my NCLEX July 5th, the day before my birthday. It was very risky. It was either going to be very, very good or very, very bad. And then I ended up obtaining my license July 6th, 2023 of this year. So when you are logging into the Board of Nursing to see if you passed your if you passed your NCLEX and got your license number is literally on the bottom. So as soon as you log in, this is just like a quick tip, as soon as you log in, like already be recording if you're going to record your reaction with your family, because I tried to record my reaction with my family and it just didn't work because I had already seen my license before I was even recording. But a quick update, I've been a nurse for, it's January 6th, July, July, August, September, October, November, December, January, February, like 7 months now. And it's been nice. I work in intensive care with like these very extensive surgeries, and memorizing like drips and what they do, memorizing drugs, it comes with time. Getting familiar with the different kinds of surgeries and what's the focus assessment for my patients, also coming with time, but it's getting better. I've been spending a lot of time with my family. I've been like picking up not new hobbies but like old hobbies, so like chess. I got to learn how to play chess, and I've been planting, gardening. As soon as I graduated, I hit like every single beach where I live. Like I mean, I needed to live. And yeah, it's been great. I did get accepted into the bachelor's degree program at my local college where I did my prerequisites at. If you guys have any questions about prerequisites, or if you guys have any questions about like applying or how to get your BSN, like I'm here for everybody. Any other update? Probably not. I think once you're finishing up nursing school, or if you're working as a tech during nursing school, you kind of get not burnt out, but you're like there's got to be something else for me out there. So I'm kind of like at that spot. I'm conflicted. I feel like I'm not really happy. It's not really like the reward isn't good enough, you know what I mean? I'm very tired all the time. So it's very important to make sure that you take time for yourself and you spend time with your family and just surround yourself with people who understand what you're going through, especially when you're a baby nurse. Luckily, I do meet once a month with nurse residency. My hospital offers nurse residency for everybody who's a new grad nurse. So we meet up once a month. We are doing like a project in like small groups, and then we're going to present our projects and then have a mini graduation once we reach a full year of being a nurse. So that's something to look forward to. But otherwise, I really enjoy what I do. I'm so glad I chose this degree, and there are so many things that you can do with it. So don't get discouraged. It's not just bedside. You don't have to just stick at the bedside working with patients. You just have to find what works for you, what you like. Do you like 12-hour shifts? Do you like 7 to 5, 7 to 3:30, whatever it is? But yeah, I appreciate everybody who's been watching my videos since 2021, and I appreciate any viewer who continues to watch my videos. I want them to still be going back to my old videos and tips on how to get through nursing school, how to start nursing school, and how to continue your education. So if you guys have any questions, please DM me. And thanks again for watching.